My name is Deanne. I'm the Director of Nursing here at Shady Lane Nursing Home in Manitowoc. I can tell you just kind of a little bit about Shady Lane and what that means for those of you who may not know what a nursing home is or what an assisted living is. Basically, we are a facility in the county here in Manitowoc that provides care for typically elderly clients in the community. Anywhere from residents who need just a little bit of care, maybe help with medications or help with the shower once or twice a week or things like that, all the way up to residents who need really complex care, care after hospitalization, rehabilitation, and end of life care and those kind of things. So we really do provide care for the full spectrum of elderly within our community. So that's really my role here, is to oversee all things related to resident care. I am a registered nurse. I have been for about 25 years, somewhere along those lines. And I got my career started really similar to something a lot of you may thinking about, which is a CNA. And that's really what I kind of wanted to talk about a little bit, is that, career pathway that's available for healthcare, starting on a youth apprenticeship and looking at other things to have opportunities to work in healthcare and really get a feel for things when you're at that, high school level, to try to look at, what are things I can try out and see, is this something I like? Is this something that I could see myself doing? We as a facility participate heavily within youth apprenticeship. We have a lot of youth apprentices in our facility, and we love to follow that career pathway with students that are just kind of interested in healthcare, but maybe not exactly sure where they fit. They're interested in science, interested in maybe just medical things, have a desire to help people, have a compassionate soul, and want to just do something that makes other people happy and makes other people feel taken care of. So you kind of feel like maybe that might be, you, or that might be things that you're looking for to feel fulfilled with a future career, healthcare might be something that's appropriate and good for you. And a great place to start is with either, a CNA class or working as an RA in our assisted living. So really to prepare for these kind of jobs, we really, highly suggest people start to maybe look at taking some of those science classes in school. That's really important, and to have a good understanding, because we're providing not only physical support, for our residents, we're providing emotional support, we're providing companionship, and we're dealing with some challenging situations as well. So the more classes and exposure that you guys can have to prepare for that, I think is better. Psychology classes even are helpful, and just understanding, working with different personalities. They're all really important things to be successful in healthcare. So, a lot of our students coming in at a high school level will start out with youth apprenticeship. They'll start out with taking a CNA class. We are fortunate to host CNA classes here at Shady Lane through a program we partner with in the state of Wisconsin, Quality CNA Training. And we have 3 wonderful rooms here that we've set aside for classrooms. Students are able to take a clinical experience and a classroom experience right here on campus. And then they actually have an opportunity to go up to the floor where the residents live on our long-term nursing home unit and be able to put those skills to use. So they get a great opportunity to work with their peers and work with their instructor and go up to the floor and work as CNAs. So they get to actually take everything that they're learning in that CNA class and be able to apply it as a student. And then when they finish that role as a student, they test, and then they're able to work as a full-fledged caregiver. So they're doing a lot of different things, helping people to the bathroom, helping people get dressed in the morning and in the evening, giving showers, all really, really important things for quality of life for our residents, helping with meals, helping people walk, exercise, those kind of things. So they're really, really critical to providing good care and making sure our residents are happy and comfortable and well taken care of. So it's a busy day for our hands-on caregivers, for our CNAs. We have a similar role in our assisted living, which is an RA, and they do a lot of the same things that a CNA does. So they're just working in a little bit different environment, but a lot of the same things. Days are busy and fast. Everyone needs everything from you all the time. So you get very good at keeping yourself organized, keeping yourself on task, trying to remember 100 things that all need to be done at one time. And trying to figure out of all those things, which is the most important thing that I do right now. It's really important to be able to work as a team. We rely heavily on each other to work together to make sure that we get everything done for the residents. And no day is predictable. I think you have to be somebody that's comfortable with that you may come in at the beginning of the day with a plan and an assignment and a schedule, and you learn very quickly as a nurse and as a caregiver that changes very fast. People get sick, people go home, your assignments may change. If something comes up, you get a new admission, the days change, and you have to be someone that's going to be flexible and able to adjust and adapt to that change and look at it with a positive attitude and say, okay, team, this is what we have today. Let's work together and let's get everything done for these folks. So I think those are really, really important things for someone that's interested in a career in healthcare, is to be able to have that flexibility and that understanding that we're human beings and that we're taking care of human beings and nothing is predictable. So you have to be comfortable with that, of kind of dealing with whatever gets thrown at you for the day, that you're going to take on that challenge and we're going to get through it. I know when Carrie and I were kind of talking prior to the meeting, we talked a little bit about kind of what are things that we like about our jobs, what are things that maybe we don't like about our jobs. And there are definitely huge benefits to working in healthcare. I think, one of the best things and one of the biggest reasons that a lot of us got into this is the need to want to help people. You have a need to want to make somebody's day better, whether that's doing something very simple, just spending time with them, whether it's answering questions for them, whether it's taking care of them medically and being able to talk with them and their families, helping families and residents, in our setting, make difficult decisions about care and about, treatment and things like that. So I think that's really, if you ask almost any nurse why we get into it and why we chose this pathway, it's because we want to help people. And we also kind of like, weird stuff sometimes. We like to see stuff that, not everybody is comfortable seeing, not everybody's comfortable dealing with. And there are those of us that, in some strange way enjoy those things that are, a challenge to get through and a challenge to deal with. So, I think those are really important things to focus on when you're looking at a career like this is this going to bring me happiness as well? Is what I'm doing with my job and my pathway, is that going to make me happy as well as being able to make other people happy? Because that's really what we do as caregivers, is we try to make the best out of some very difficult situations. We're helping people at sometimes very sad, very low, very difficult times. They don't feel good. They're dealing with a lot of things physically and emotionally. And as a nurse, you have to be able to find it in you to provide support to them. And I think that's one of the things that's the most challenging as well, is to maintain that professional boundary of, I care about my residents, I want to help them, I want to help my team, and maintaining those boundaries, understanding that this is, there needs to be a line between that relationship. It's hard not to get attached to people. It's hard not to get attached to their families. Some of our residents in our facility have lived here for years. You get very close with their families. You get very close with the residents. That's definitely a challenge. And I think as a nurse, in long-term care, we always look at it, and I've always looked at it as there, as long as I did something, I hope I did something to make their days better, something to make their days brighter, to make them more comfortable. And there's definitely a gift that they give back to us as well as caregivers, back to us saying, thank you. And when families are appreciative of what we do, I think that's a really good benefit. It gives you that feeling that you're valued and what you're doing is important. So, I think those are kind of maybe the good and the bad of working in healthcare. It's definitely challenging right now. That's any person in healthcare you talk to is probably going to tell you that it's hard work. And it's been an interesting time right now for all of us in healthcare navigating this pandemic. Something you don't think as a nurse, well, it happens every 100 years. Well, lo and behold, it's happening during our career, and it's happening right now as far as living through the pandemic and dealing with that. So that has definitely posed a different set of challenges, for us in healthcare. But I think, starting out as a CNA or as a caregiver is a wonderful pathway to start no matter what you're doing in healthcare. I think that having that understanding of what makes people happy and comfortable is huge no matter what you're doing. It's going to make you a better nurse. It's going to make you a better physician. It's going to make you understand the importance of just helping people on a one-to-one level and making them feel good before we do all the other things that we do as professional caregivers. So, I think it's a wonderful place to start. I'm glad it's where I started. I think it's helped me get where I am, and it's helped me, be the nurse that I am today. So it's a great place to start.
Great. Thank you, Deanne. I just want to let our participants know that they can put some questions in the chat if they have questions they'd like to specifically ask you. So go ahead and do so. In the meantime, you talked a little bit about two different pathways. The RA, which stands for resident aide, and then
Mhm.
also CNA, certified nursing assistant. So can you highlight what a resident aide does and what specifically are some of those job duties that a CNA does?
Sure. CNAs and RAs really do a lot of similar things. They work in two different environments. So our CNAs actually work with our nursing home residents, and our nursing home residents and most nursing home residents in other facilities are residents that are either there maybe for a rehab stay or they're there for a long-term, stay for pretty much for the end of their life. They're going to be within your facility. So we're helping people go to the bathroom. We're getting people washed up in the morning and at night. We're getting people dressed for the day. We're helping people brush their teeth, comb their hair, put their dentures in, put their hearing aids in, helping them go to the bathroom throughout the day, helping them walk, helping them transfer. So really a lot of hands-on care, day-to-day care is what those CNAs and those RAs are providing. RAs actually work in the assisted living setting. You do not have to be a CNA, so that's the big difference, is you don't have to take the CNA course to work in the assisted living. You can work as an RA right away. So you don't need to take that CNA class. It's a different license, so there's a little bit different education requirements. But they're doing a lot of the same things, a lot of, things to, day-to-day activities of daily living. We call them tasks, a lot of the similar things. So you really can go either direction. And I know with YA, you can go either direction as well, as far as the CNA course or the RA course pathway as well.
Great, thanks.
Mm-hmm.
Can you talk a little bit more? You mentioned some of those job duties, helping people use the restroom, helping them shower. As a high school student, how do you coach your students to handle that?
Mm-hmm. It's hard. And like I said, you're really working with people at some of their most vulnerable times, some of their most difficult times. So you are really, they're as uncomfortable as we are. So we want to always just make sure that that resident is comfortable and they're not embarrassed and they're treated with respect and dignity. We always just try to assure people, so many people just apologize and I'm so sorry, I don't want to bother you, and I'm so sorry that I had an accident, or I'm embarrassed. And our job is always to just say, you know what, it's not a problem, I'm here, let me help you. And you just have to remember you're doing something that is very personal and very difficult for someone to have, for an adult to have another adult or someone younger than you providing those cares. So we just do our best to try to, we get done exactly how we need to do it, and we do our best to make sure that it's dignified and we're keeping as much privacy as possible, and just reassuring the residents that, hey, this is okay, this isn't a problem, no big deal, we do this every day, let's get you taken care of, and bingo's in 10 minutes, and we just help them work through it, and we move on from there.
Great, thanks.
Sure.
Question came in. Can you talk a little bit more specifically about the CNA course? How
Sure.
long does it take? Typically, when do those courses run?
Sure. Like I said, we partner with Quality CNA Training, so they host the classes here. The classes typically run anywhere between 4 and 6 weeks, depending on how many nights a week they're meeting. They do meet on the PM shift, so anywhere between like 4 to 8, 3 to 9. It just depends if it's the 4-week course, their classes are a little bit longer because they're cramming a little bit more in every day. If it's like the 6-week course, they'll do like a 4 to 8. Usually about 3 nights a week. So they'll meet 3 nights a week, and then they will have their clinical and some other things that'll happen like 2 weekends in there within that 4 or 6 week time span. There's some weekend testing, and then there's some weekend clinical time, hands-on time, where they're actually on the floor on a Saturday and Sunday in the morning. So typically anywhere between 4 and 6 weeks. In the evenings, about 3 evenings a week. It's about 75 hours worth of training. If you are interested in taking the CNA class, you can do it actually as an employee of our facility if you choose to say, hey, you know what, I think you guys would be a good fit, and we would interview you and think it would be a good fit as well. For that CNA class, we will actually pay for the CNA class, and we actually then pay you for your time in the CNA class as well. So it's really a win-win if you are interested in taking the CNA class and not going down maybe the youth apprenticeship pathway, if that schedule or that doesn't work out for you. It's another great way, and we do have high school students who will do that. or maybe perhaps they're kind of interested in healthcare but not quite sure. We have a lot of our caregivers that are interested or that take the CNA class start out in the dietary department. So they'll work in the dietary department, and they are interested in, not once they get on the floor a little bit and they get to have some time with the residents, they get to see what the CNAs do, they get to see the fun relationship that the CNAs have with the residents. And in a couple of months, they'll come around and say, "Hey, I want to take the CNA class." So that's kind of another way to get your feet wet a little bit and get in, and really check out what long-term care is all about.
Great. Can you talk a little bit about what would the work hours be in the CNA and the resident aid role?
Mm-hmm.
We know it's not
Mm-hmm.
9 to 5, but talk a little bit about expectations for hours.
I think one of the things off the bat people, need to remember is healthcare is we are 24/7. So we are nights, we are weekends, we are holidays, we are here every day to provide care to residents, really no matter the setting, whether you're in a hospital, whether you're in a nursing home, where we have residents, we have to be here around the clock. So a lot of our youth apprentices or a lot of our high school students will for sure work every other weekend. So they'll work a full 8-hour shift on Saturday and an 8-hour shift on Sunday. So they'll work every other weekend. And then most of them will work a few short shifts during the week. So that still gives them a few nights off during the week. But it gives them some time, depending on their school schedules, if they can work. Some of them do have that freedom to have some work hours during the day or in the evenings. A lot of our students will work a lot of hours in summer or on school break, which we appreciate when our regular staff is, taking vacations and things like that. They'll pick up a lot of hours in summer as well. So we're somewhat flexible because we know that we need to be. But at the end of the day, I still have residents here that I have to take care of every day. So, when we hire somebody on for a caregiver position, we really do need them to kind of stick to that schedule and to be here on the days we need them to be here.
Great. Can you talk a little bit about the average wage range? And then also, what are you looking for in somebody that you bring into your facility to take that CNA class or to be in that resident aid or even a dietary role?
So wage range, basically, for those CNA RA positions, it depends. We do our pay based on we have a few variables in there. We have committed hours in there. So however many hours we commit to, the more hours you commit to, the more you get paid. So anywhere between, starting out like, over 12 an hour up to like our full-time evening and night shift positions are over 17 an hour. So it's a pretty big range depending on what shift you work and how many hours you commit to. For us, really, the main things that we need from our caregivers is we need somebody who's going to be kind to our residents. We need somebody that's going to be reliable. We need people that are organized. Like I said, you're asked to do a lot of things in a short amount of time, and there's a lot of responsibility for a high school student to be maintaining a position like this. There's a lot of responsibility. So, I think those are probably really the biggest things. As long as you have a heart for caregiving, we can teach everything else. We can teach those skills. And, so many people say, I could never be a nurse because I don't like needles. And well, I'm a nurse. I don't like needles, but you know what? We still do it because it needs to be done. But, there are things that we can get through and we can work through together. But I think, truly, if you have kindness and compassion in your heart, we can teach you how to do everything else. Those are the big things for me.
Can you talk a little bit about what age somebody would need to be in that dietary resident aid and also CNA to be able to take the class?
Sure. Within the dietary position, some of them will start out at 15. When they turn 16, a lot of times they'll transition into more of the caregiver type roles. The other positions for a CNA would be 16 to take the CNA class. To work as an RA, you do need to be 18, unless you're working as part of a youth apprenticeship agreement, which I know youth apprenticeship does have the RA pathway. If they're working as an RA through youth apprenticeship, they can work there anywhere from 16, 17, 18. We just have to get a waiver from the state. So we just have a little paperwork to do on our end to make that happen.
Great. So if I told you that I'm going to be a radiologist someday, and why would I need to be a CNA, or why should I be a CNA? How would you respond?
I would absolutely tell you that any of those caregiver positions, the CNA is a wonderful skill to have. Even working as say an X-ray person, or somebody who's going to anesthesiology, or something like that, whatever you're interested in going into in healthcare, before you do any of those other tasks, you have to know how to make people feel relaxed and comfortable. So you need to be comfortable moving people around. You need to be comfortable turning people. If you're in the middle of a procedure and someone says, I need some help going to the bathroom, for you to be able to just do that in your position and in your role and feel comfortable doing those things, I think it makes you feel comfortable providing very personal cares for people, which makes you a better caregiver, don't you, regardless of what position you're going into. It takes away that uneasiness of getting in somebody else's personal space and helping them with some very personal tasks. You get comfortable doing those things when you're a CNA.
Okay, great. What are some of your favorite things about working with high schoolers and working in that CNA? What are things that you see on that outside perspective that they take away from doing that experience?
I think one of the best and most exciting things for me is to see their confidence grow in who they want to be. They'll start out, we interview them for youth apprenticeship and they're like, I think I might want to be a nurse. I think that might be something that I want to do. And that's why I'm interested in youth apprenticeship. And when you get to see those students like quarter after quarter, their confidence grows, their interest grows, and their desire to be a caregiver grows as they proceed through youth apprenticeship. It's pretty rare you get somebody to the end of youth apprenticeship and they're like, yeah, this isn't really what I want to do. They get to that youth apprenticeship time and they're like, yeah, I know absolutely this is what I want to do. And I think that is probably one of the most satisfying parts for me, is just seeing that confidence grow and just seeing them really solidify their pathway. There's nothing better, I think, as a parent, as a teacher, as a leader, to be able to see people really just, see these students kind of find their own and find their course and their path of this is what they want to do. That's what we want as leaders. That's what we want as the teachers and parents. We want those kids to find that role and that job that's going to make them happy and feel good. And I think that's one of just the best parts. And I mean, we have, our student now, we have, I always use her as an example, but she started out in dietary, transitioned into nursing, and now she's on her second to last year of nursing school, still working with us, 6 years of working with us. We've been able to see that whole progression from a 16-year-old dietary aide now to a 21-year-old nurse. She's working as a nurse intern right now and is going to be finishing nursing school. So to be able to watch that growth is awesome, and that inspires me as a caregiver to be able to say, this is our next generation, and I'm happy to see people choosing this pathway. So I'd like to be a little part of that.
So if I get my CNA certification when I'm 16, does that expire?
You do need to renew that. That is something we work with as a facility. If the expiration is coming up, we track those. So it does expire and need to be renewed every couple of years.
And what would be your recommendation for somebody that has that CNA certification, but they're going off to college?
Mm-hmm. Keep it. Always keep that CNA certification, especially if you want to work as a nurse intern in the state of Wisconsin. If you are pursuing a nursing career, you do need to have that CNA certification to work as a nurse intern. So I think that's one thing that's really important. And it's one of those skills that you can take with you and you can work anywhere. So you may do, youth apprenticeship in high school for a year or two, in your hometown, and then you're going off to Madison or you're going off to Milwaukee, you're going off to school. You can definitely take those skills with you. You can work anywhere. It's one of those things that you can take with you and you can keep. And it's really, really important to keep up with that CNA certification and your training.
Great. Is it true that a lot of our college level programs are now, such as nursing, are requiring you to have that CNA? I've heard physical therapy, radiology.
Yep, they are wanting you to have that CNA, at least take the CNA class. Not all of them require you to do the actual certification and exam, but all of them do require taking that CNA class. So it makes you, and I think they see the value in what that class provides as being a hands-on caregiver. So I think it's important to be able to do that. And we definitely recommend it for anybody going into healthcare positions.
And Deanne, I know we had a question come in. Can you explain a little bit more? We talked a lot about the RA and the CNA. Can you talk a little bit more about that dietary role and what that entails?
Sure. Yep, and we have dietary, youth apprentices or dietary positions as well. Dietary aides usually, a lot of our dietary aides are high school students because they're working after school, working on the weekends. So they come in, they're helping get food prep on the floors. They're helping serve food on the floor. So they do have some interaction with the caregiver staff and with the residents on the floors. They're helping dish up food. They're following, looking at what diets the residents are on, what food consistencies they need. They get to learn that so-and-so doesn't like peas and that's on the meal tonight. So I know they're going to want corn instead. And they get to know the ins and outs of the nutritional needs of the residents, and they get to have some of that interaction as well. And it's a good opportunity if you're kind of thinking this might be your pathway to get in and look at those positions. So we do take applications for dietary positions as well.
Sounds like a great foot in the door to get
Absolutely.
individuals started. To kind of end, if there's any other questions, they can please put those in the chat. And I guess I would just leave you, explain to me what your favorite thing is about your job.
That's hard. I've been doing this for a long time, Carrie. You know, I think for me at the end of the day, you know, in my role as the director of nursing, my job really is to oversee everything resident care. So it's looking at nursing, it's looking at dietary, it's looking at activities. You know, for me, it's the feedback that I get where I get it from the residents or the families that we feel like everything we're doing a good job. And I think that's the best part for me is knowing that the efforts that, you know, we're putting in and all of the things that we do are making our residents and our families happy. And they're feeling like we're doing a good job, because at the end of the day, they're my customers. They're the reason we're all here, and we need to make sure that they're happy. So for me, that's truly the best thing, is to know that, you know, at the end of the day, we feel good about the work that we're doing, and they feel good about, you know, the care we're providing. That's the most important part for me.
Great. Well, I just want to thank you for your time today. It looks like we don't have any more questions. I appreciate all your work for volunteering to do this, but also working with our high school students to give them an opportunity to kind of explore a career path.
Happy to do that.
So thank you very much.
Of course. Thanks.